Welcome to today's Global Connections program. I'm Bill Miller. What is the United Nations World Health Organization, commonly called WHO? What is WHO doing to combat Ebola, as well as teaming up with Rotary International to eliminate the world from the scourge of polio? We'll be back in just a moment to talk about these and other important issues. Welcome back to our program. Today we're taking a look at the United Nations World Health Organization and the role it plays in working to combat diseases all around the world and to promote other health initiatives. My guest today is an expert on this institution, the agency, and these diseases. My guest today is the Executive Director of the United Nations World Health Organization office in New York. My guest today is Dr. Nata Menabde, who is the director of the WHO office at the United Nations. Dr. Menabde, welcome to today's Global Connections program.
Thank you very much. I'm very pleased to have an opportunity to speak to you today.
I appreciate you being with me. We're going to get into the issues in just a moment. Let's talk a little bit about the World Health Organization. When was it formed? Why was it formed? And why is it important to help people to lead a healthier life, to be quite honest?
WHO was established in 1948, so we are nearly 67 years old now, a little bit younger than United Nations itself, and we are health directing and coordinating agency within the United Nations. What we do is we help in setting standards for various areas in health. We help in developing guidelines on the basis of best evidence available. We ensure that knowledge transfer happens between the countries on the best of experiences that they apply. And we also monitor health situation in the countries so that everybody knows how the progress is being achieved. So we are providing policy advice to the governments on how they can best tackle their health challenges.
Exactly. And our viewers, if they'd like more information on the World Health Organization, they can go to who.int and learn a lot more about what you're doing. And we'll find out a lot today as we go through this program. We've heard a lot about the UN Millennium Development Goals were adopted in 2008, logical, practical, quantifiable goals to reduce abject poverty, to promote universal primary school education, empower women, to reduce maternal and child health deaths or maternal and child deaths. And now we have the Sustainable Development Goals that are going to come into force basically January 1st, 2016. There are 17 of these Sustainable Development Goals. What are a couple of these goals? They're all important, obviously, combating climate change and promoting food security and eliminating poverty, but are there certain ones, they're all connected too, but are certain ones that tie directly into what you're doing, or more directly, I should say, into what you're doing in the health arena?
Health has always been, and even more so today, is a central issue for development. It has been central to the Millennium Development Goals. There are several Millennium Development Goals that are dealing with health. We have been very fortunate to have attention of the world leaders to those health challenges, and a lot of progress has been achieved also as of today. But Sustainable Development Goals give us even greater opportunity because they are actually opening broader scope for interventions. They are opening and inviting all the partners, all the sectors to work together to combat them. So it is now no longer a silo or agency by agency operation, but it is agencies, partnerships, coalitions, alliances that will make a difference in implementation of SDGs. For us, it's a great opportunity because we are not only looking at the of course, this is specific health objectives to be achieved, but broader issues such as health system issues, such as emergency response issues, such as creating more resilient systems in the countries so that they can deal with any of the challenges that may be posed to them. So in that sense, goal of universal health coverage in the Sustainable Development Agenda is really one of the central ones as far as WHO is concerned. However, of course, there are many health issues which are integrated in the other Sustainable Development Goals. We have health issues under the climate change agenda, we have health issues under other environmental challenges, we have health issues on the transport and energy issues. So everywhere you can find space for health. But our primary focus will be on universal health coverage, and another one is on the non-communicable diseases, which are getting into greatest threat in terms of health for our people.
Exactly. And it hasn't been too long ago we were reading a lot about and really fearing the Ebola virus, which is a very deadly virus, as we're well aware. And what is, I realize that things could change tomorrow, but as we speak today, what is the current status of the battle against Ebola, especially in those 4, I think, Western African countries where the Ebola was really raging? How is the battle going against Ebola at this point?
I think all our efforts have brought us to some good results. In the last week, we only had 3 cases of Ebola in 2 countries, Guinea and Sierra Leone. We didn't have any case in Liberia for some time now. And in fact, this trend has been developing over the last couple of weeks. We have not seen more than 3 cases over the last 3-4 weeks. Of course, this is a very unstable and unpredictable development, but it's a very good achievement, and it's certainly a result of massive effort of WHO, of the communities, of the governments, of all the partners who are there in the field. And the situation was different a couple of weeks back. We had between, around 24 cases some weeks. So there has been steady reduction. The trend is right. We are moving towards 0. We want to achieve 0, and we want to sustain on 0 numbers. So that's something good happening also today, because Liberia has been announced now again as free from Ebola virus and entered into the intensive surveillance phase of 90 days, which is starting as of today. So we really hope this is not going to bring us any new cases, but we must maintain strong surveillance system. We must watch out the situation. We must be ready for any unexpected development. We still want to trace all the contacts of all the people who carried Ebola virus. So work is continuing in the field. It's very intensive, but the progress is seen.
Exactly. And of course, with any crisis, it's a disaster, but there are lessons learned. And it sounds like you've mentioned several of those lessons right now, that we need to be on our toes for future problems, perhaps with an Ebola outbreak or some other outbreak. We never know what is exactly going to happen. Now, the United Nations World Health Organization is a frontline agency in coordinating efforts and developing policies to combat health problems and promote healthy programs, I should say, or health programs around the world. When I think back, I guess from 1965 to about 1980, WHO led the effort to eliminate smallpox. That was a major undertaking because smallpox had ravaged civilizations for hundreds of years. Today, you're teaming up with Rotary International, with the U.S. Centers for Disease Control, with a sister agency, a UN agency, UNICEF, the UN Children's Fund, to eliminate the scourge of polio through the Polio Plus program. Talk a little bit about the Polio Plus program and how that's progressing and how it's advanced over since about 1985, 88, along in there until today.
This is a very important topic and very close to my heart. I have been fortunate to be involved in eradication of polio in European part of WHO in 2002, and I have witnessed also other regions eradicating polio in WHO terms. And now I have been also in India when India has succeeded in eradicating polio last year, and that led also to whole Southeast Asia region to become polio-free region. So we have been steadily moving on this important objective with help of partners, with a great support from Rotarians indeed, but also from UNICEF, CDC, other partners, and most importantly, it has been government-led effort in all countries where the success has been achieved. We are now at the situation where we have only 2 countries that are still polio endemic. This is Afghanistan and Pakistan. Nigeria actually last month has accomplished 1 year without polio virus, so transmission has been stopped, but it still requires another 2 years to get certification for the region that there will be no polio transmission. So I think we are progressing very well, but it's a very challenging situation. It's difficult to predict how things will evolve. A lot of work needs to be done in Pakistan and Afghanistan. And until there is even 1 polio case in the world, every child in the world is at risk. This is something very important. Today we had 2 polio cases, outbreak of 2 polio cases recorded in Ukraine that has not seen polio for 9 years. So 2 children got infected because the vaccination rates went down and they had no vaccine, they had no vaccination. So not enough vaccination happened in the last couple of years. And we are facing here 2 cases. So now whole government is on their toes to respond to this situation with support of the WHO and UNICEF. A lot of action is taking place. So we need to be aware of that. It's a difficult challenge. We need to complete this job if we want to, A, save so many children or so many lives or so many children from being crippled, but also to save a lot of resources which are still going and spent all over the world to protect and prevent.
Exactly. How difficult is it for the people who are on the ground, the Rotary volunteers? There have been literally hundreds of thousands of Rotary volunteers, UNICEF employees and what have you, who go to the headwaters of the Amazon, who go to the outback. They go all around to any place that people are living, they have to go to immunize them. How difficult of a job is that, and how dangerous is it?
It is an extraordinarily difficult job, especially in those settings where systems are dysfunctional, where it's difficult to reach people, especially the migrant populations. You never know where they are, so you have to monitor. You have to account for every household, for every child, and this is an enormous job. Now, having done it recently in India, we have been partnering with so many community leaders, religious leaders, school teachers, families, everybody, to get this thing moving. And we had incredible, unprecedented commitment of the local vaccinators. Millions of doses of vaccines have been administered every year, month after month, in incredibly difficult conditions, such as walking 18 kilometers with bare feet. One of our vaccinators who was awarded on behalf of all the vaccinators in India by the UN Foundation I think 2 years back. That woman has been walking 18 kilometers with bare feet to deliver vaccines in the floods, in the night, in the heat. It's very difficult. In some countries, it has even been dangerous for lives of vaccinators. We have seen number of lives lost, including WHO staff, in the attempt to reach out and vaccinate all the children. It's a difficult task, but it's doable with the commitment and support from all involved.
Well, you're watching Global Connections Television, which is an independently produced program. The opinions expressed on Global Connections are solely those of the moderator and his guest. We would encourage our viewers to go to our website at www.globalconnectionstelevision.com and look at some of our previous shows. Also, give some thought to perhaps future topics and future guests for Global Connections programs. Today we're looking at the United Nations World Health Organization, a frontline agency that works with groups such as Rotary International to combat polio, working with various groups to combat the Ebola outbreaks that have taken place in various countries in Western Africa. And my guest today is an expert on WHO and on these issues. My guest today is the Executive Director of the World Health Organization Office at the United Nations, Dr. Nata Menabde. Dr. Menabde, we're talking about WHO and what you've done with Rotary International, with other groups. There's another facet too. When we're talking about health, we have to think about clean water. We have to think about sanitation practices and that type of thing. How are we moving in that direction? How are things going to, how important is it for people to have clean water and to have healthy sanitation practices?
It's extremely important because there are so many waterborne diseases that people get infected with. And of course, in the communities, in the countries where safe water has been delivered to people for many years, we have not seen those diseases killing children and adults. But in the countries and in the communities where we do not have enough access, we are still losing lives of children, lives of mothers, lives of community members. So it's extremely important. And Millennium Development Goal has been looking at those issues, and there were specific targets that were set. By the way, as far as safe water is concerned, we have accomplished and reached the target. So now more than 90% of the world's population have access to safe water. So this is really magnificent, major accomplishment, and indeed the world has to be proud of having achieved that. Unfortunately, I am less happy with the achievement of the sanitation targets, because we are still having nearly 1/3 of the world's population, more than 2 billion population in the world, not having access to sanitation facilities, and even nearly 900 million people still openly defecating. So this is a significant challenge and a threat for health issues. It is affecting malnutrition of children. There are so many things that we can improve by just solving this one major problem.
That's certainly good news on the water, and we have more to do on the sanitation. It just so happens you recently released a report, very interesting report, 25 years progress on sanitation and drinking water, 2015 update and Millennium Development Goal assessment, MDG assessment. You've already talked about some of the statistics. What are some of the other findings that came out of this report that we need to know about? I'm sure everything in the report we need to know about, but are there a couple of others that we need to keep in mind as we look at these problems?
What this report shows is that everything can be done, that the numbers have been on the right trend and improving, and we have achieved substantial progress, but it shows that there are huge inequalities between the countries in achieving those results, and also within the countries. So these are not a very positive issues that we are finding, and inequalities are growing, so we need to find solutions. It also shows that we need to innovate better, and we have to find low-cost solutions for those particular specific contexts in the countries where we are still behind with the sanitation targets in particular. So that is something which report is very important about. It sets also recommendations for the future, for the action. We have been also looking at some gender-specific issues within this report, like, for example, sanitation facilities for girls and for schools. So these are very important issues which are affecting some part of our communities. And the report has been looking at disaggregated data and has been identifying countries that have been progressing well, those that have been progressing less good, and identifying what actions can be done to improve the situation. One thing is clear. In the Sustainable Development Agenda, we have to be by far more aggressive and more action-oriented if we are serious about achieving these targets. And if we don't, then we are compromising on several other targets as well.
Exactly. And you mentioned the girls in school. There have been studies and reports that have come out indicating how important it is for young women to have separate toilet facilities, and that actually helps to improve their attendance at school, which is absolutely critical as being the first step perhaps to empowering women, which is goal number 5 of the new Sustainable Development Goals, is it not? Even a small thing like that can be very powerful and very important.
Sometimes it has been felt that building more toilets is going to solve the problem. Unfortunately, that is not enough. You need to invest also in educating, in changing behaviors, and you have to have strategies for that. So it's not enough, as we have seen in many places, toilets have been constructed and facilities have been there, but people are not using them. So in some of the surveys, you can even see that people are not using it, even in a high-income quintile of the population. So people who do not have shortage, do not have economic challenges, they still sometimes not use those facilities in full. So we need to work more on understanding those needs of specific population groups. We need to educate the rest of the communities also about those more specific needs of parts of those communities, and create more opportunities for girls and for women, and of course, to get educated, to get into schools, to fully realize their potential. And it's also about issue of dignity, which is very important and unfortunately gets ignored in many societies still.
Exactly, and that's a very important point. It's a multi-pronged approach. There's not one good idea to help a girl to get to school and stay in school, but it takes many layers and many areas where they need to be involved. But how important is it to educate girls? How important is it to empower women, women who are already adults, let's say, as far as them being involved in helping to create this better world, as far as them being able to help improve the status of their lives, of the people in their family, perhaps their community, their country, perhaps the world to some degree. But women play a critical role in this, do they not?
Absolutely, and there are many studies that have shown that women, empowered women, well-educated women can change a lot in their communities, in their families, can have healthier children, and have been to live productive life also for the communities. So there are plenty of studies and a lot of numbers which we can bring here. That is all known, but we also have to think of women not just as somebody who can improve life, but also for themselves. They have to live full life, to be happy, to enjoy life also. And we know that, for example, there are more aspects of violence against women, against children even. We know that women are more vulnerable to sexual abuse, for example. So all these things push women into depression, push women into some health problems, which prevent them then to be full member of their society and the community. So it is critical. It is one of the most important strategies, and it will definitely have high attention also in the Sustainable Development Agenda.
Now, the United Nations General Assembly declares many days certain things that are going to happen. We have a variety of days dealing with poverty, with various diseases and what have you. April 7th is World Health Day. What is the significance of that designation by the UN General Assembly and that date of the year to focus the eyes of the world really on health and health issues?
Well, 7th April is a birthday of WHO. In 1948, we were established on 7th April. So this has become a tradition to bring some issue which is relevant for all the countries, which is relevant to the population at large, to the attention of people. And that's how we have been choosing topics for the World Health Day in the past and now also. Like, for example, 2015 World Health Day has been dedicated in April for food safety, to make our food safer. Very much linked again with the water safety, and there are a lot of microbes which can get into the food, and then there are some 200 diseases that people can get from those microbes, and so that's why it is important. So that's what we do. We choose a topic which is broadly relevant for as many countries as possible in different ways, and we bring some facts and attention of those to people so they can respond adequately. One of the previous ones was about hypertension and about risk that hypertension carries, and how many people don't even know that they have hypertension, and it's a silent killer. So it was an attempt to help them to check themselves, be aware, do some actions against it, and extend their healthy lives as much as possible. So this is what we do. It's significant. It's a single topic-based event. We carry whole year several events to re-emphasize the significance of this topic. And the 2016 World Health Day will be dedicated to diabetes, because diabetes is one of those non-communicable diseases that are growing very fast and increasingly capturing more and more people. It's an important disease, and people have to know what to do, how to prevent it, and how to control it.
Exactly. And just as it is with climate change, we all have an interest in that, and we should have an interest in health and diseases because they can affect us at any point in time. And of course, Dr. Nata Menabde, you're dealing with these issues every day, and it goes to show, I think, really the unique public-private partnership that could be developed between like a United Nations or a couple of United Nations agencies and a private group such as Rotary International or with Kiwanis International or Lions International, other groups like that, that can come together and you can pool your resources and pool your collective knowledge to work on these problems and to be very effective and very successful in the long run. But they're very important, and we would encourage viewers to go to who.int to get more information about these topics and what we've been talking about, what we didn't get to talk about today. But I want to thank you so very much for a very interesting and a very informative program.
Thank you.
I'm Bill Miller. Thank you for joining us today on Global Connections Television.